Alright, so we're going to go ahead and do an ear cytology here on Cassie. I have my cotton swabs, I have my saline to moisten my swab, and I also have my glass slide here as well. So she just has a mild infection, which kind of looks or smells like a yeast infection, just kind of on the outside of her ears. So I'm just going to go ahead and take a swab of that. You stay. And what I'm going to do first is moisten my swab. And I don't want it to be too wet. Stay. And then I'm just going to gently take this to the inside of her ear. And I'm just going to kind of go in circular motion. And you want to make sure that you're not putting too much pressure on this so that it breaks the stick or anything. Stay. Good girl. Stay. And then I'm just going to go ahead and put it onto my slide, and I'm just going to roll it across, and I'm going to make certain that I'm not overlapping or going back over this slide. So I have two nice big smears on here, so I'm just going to go ahead and let that air dry, and then we'll go ahead and stain it. Alright, so my ear smear has now been air dried. So what I'm going to go ahead and do is just light the flame, so it helps to adhere it on there. Quickly light it. You don't want to sit on there too much. And we have two different sets of stains. One is for just my ear cytologies, and then this other one is for a lot of our blood smears and cytologies for various things. So I'm going to go ahead, and we have a 3-step system here. And I'm just going to go ahead and put our first step on there. And I like to let everything sit on there for about 30 seconds. Hey, Cassie. You want to sit? Stay. Stay. And I'm just going to kind of wipe off some of the black stuff, soot, or whatever it is, from the match, so that whenever I go ahead and I dip it into these other ones, I'm not getting all that gunk in there. Alright. So that's been about long enough, so I'm just going to kind of shake out that excess, and then I'm going to go ahead and dip it into my number 2 stain. Cassie, good girl, stick. Alright, so now that I'm done there, I'm going to shake out the excess and then dip it into my third stain. One thing you always want to make certain too, which side is the side that you're going to be looking at underneath the microscope. It just helps to know which side is the upside and which side is down. So I like to always keep the upside kind of facing towards me. Alright, so the ear smear is now dry. I'm going to go ahead and put it underneath my microscope, and I just want to make sure that I have the right side up, which I do. Alright. So I first start this out on 10, and I'll go to 40, and then I'll go to 100. Alright, so I have it zoomed in on 10. Now I'm going to go over to 40, and I like to try to start on the edge of my smear, so I can kind of go back and forth. Alright, I'm on 40, so I'm going to get ready to switch over to 100. I'm going to add my immersion oil. Set that over, light up. Alright. So on a lot of ear cytologies, you'll have various debris or epithelial cells, along with sometimes you can have yeast or cocci rods. Cocci and rods are forms of bacteria, and certain kind, depending on if it has a yeast infection or a bacterial infection, that will determine what kind of ear medication you're going to go ahead and administer. So you want to make certain that you're looking over the entire smear so that you can get an accurate count of what all you're seeing. So far I'm just seeing very tiny amounts of yeast, or trace amounts of yeast. I've only found 1 or 2 over the slide that I've looked at so far, which isn't very much. And then there's also some various just debris on here. A lot of dogs obviously have dirty ears, and so there will kind of be some debris on there. And I kind of focus in and out as I'm doing this. And once you go over the entire slide, you'll kind of estimate how much yeast or cocci or epithelial cells or what all you see on here. You know, if you're seeing about 1 yeast per fill, then it'll be 1. If you're seeing 4 or more, there'll be +4 yeast. Same with bacteria. Alright, so I'm going to go ahead and take my slide off. After I get done looking at it, I'm going to clean off my microscope. Always make sure to clean it off after each use so that it can focus in next time. You don't have to worry about cleaning it off that time, and you don't want this to dry on there. And then I also like to set my little table thing down in case it decides to flip around so that none of the pieces get messed up. Alright, so continuing with the budding and the non-budding yeast. So non-budding yeast kind of look like bowling pins or little, you know, 2-piece snowmen, whatever you want to call them. So here we have an example of the non-budding yeast. Yeast are fairly common in ear cytologies. I see a lot more yeast than what I do with bacteria. A common trait of the yeast and the ear infection is you kind of notice kind of like a yeasty smell to the ears. A lot of times it's more of a darker debris in the ears. So that's fairly common. With bacteria, I notice usually more of kind of a yellowish discharge, usually more liquidy. The yeast infections can sometimes be a little bit more dry. And sometimes you have mix. Sometimes you have yeast along with bacteria. Here is just a little picture of some rods on here. Rods look just like what a little tiny rod would look like. Cocci are just little small circles. And a lot of times you'll find them in clusters, of kind of grape-like clusters, or 4 of them together kind of forming the shape of a square. You'll also see lots of debris sometimes in ear cytologies, or you'll see different kinds of skin cells, epithelial cells, kind of mixed up in there as well.